Congressman Mark Green is here, chairman of the Homeland Security Committee, former Army Special Operations Flight Surgeon. Good to see you, sir. There's been this sort of late afternoon court ruling out of Florida that says that they cannot do parole, which is the easiest way to basically just give people a pinky promise and say, all right, move on off your way. Here's your plane ticket to New York or Chicago or wherever. Is that going to really materially change what's happening at the border over the next 48 hours?
Well, I'm not sure it'll change it over the next 48 hours because the people who started this trek to come, across our southern border started days ago and they're en route. However, that is the problem. Mayorkas, since he became Secretary of Homeland Security and Biden president, they've done away with the detention pending a court hearing, right, or a court date. And that detention was a deterrent to coming here. A lot of people didn't come because of that. Of course, Trump put them in Mexico for that processing, but they did away with that too. This court requires them to actually come up with a date, and that's going to delay the process. That may be a deterrent downstream, but not for 48 hours.
I think about the people that we don't know about, because there are as many people as we see being detained. There's the same number, probably, if not more, than who are getting away, at least according to the sources that I'm talking to down on the ground. You may have better numbers. And I want to be careful here, because one of the real stereotypes of immigrants is they bring disease. We've heard about that. People said that about my immigrants when they came over from Ukraine in the early 1900s. But the fact of the matter is the people who are being sort of either let out and or the people who got away are not going through any of the screening that normal legal immigrants into the United States get. Tuberculosis by state. New York City's TB rate, 6.1 cases per 100,000, more than double the national rate. Florida, 21% increase in TB since 2020. Texas border counties have a TB triple the national average. And tuberculosis is weird. You know, obviously this better than I do as an emergency room doctor, but that it can be latent for 6 months. And I'm wondering, is there a ticking time bomb that is now coming into the United States through no fault of these people's own, but it still is going to affect all of us?
Well, there are healthcare issues. You think, too, not only about tuberculosis or what's even worse, drug-resistant tuberculosis. Those strains are out there, less likely in Central America and South America because they haven't been treated. But is the loss or lack of vaccinations, whooping cough and things like that are also coming into the country. But those are, honestly, I'm more concerned about the fentanyl and you mentioned the gotaways. It's been 1.5 million since this president took office. How many rapists, how many, human traffickers? Why are they not just turning themselves into Border Patrol if they're just going to get released into the country? There's a reason that they're wanting to avoid Border Patrol, and who are they? There's also the Chinese nationals. We've had 16,000 come into the country just.
Thanks for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to subscribe. Click the red button to get more of NewsNation's fact-driven, unbiased coverage.